Hello, and thank you for taking time to join us for our presentation on college spread of COVID-19 in Ohio. My name is Kim Brooks, and I'm currently working on my Master's of Data Science at Bowling Green State University.
And my name is Akinkunle Hakinola. I'm currently working on my PhD in data science at Bowling Green State University.
And I'm Vibhuti Chandna. I completed my master's in computer science from Bowling Green State University as well.
My name is Alka and I recently completed my master's degree in Bowling Green State University. I hope you enjoyed the presentation.
Unless you've been living totally off the grid or as a hermit for the past few years, you know that we are in the midst of a global pandemic caused by the SARS-CoV-2 virus. When the outbreak first began, there were many theories about the transmission of the disease, but eventually we learned that the virus is spread through airborne aerosols, making it much more transmissible than was first thought. Steps were taken to eradicate the virus, including, but not limited to, wearing face masks or shields, work from home orders, vaccinations, etc. We just happen to be experiencing all of this with the rest of the world during the time that we happen to be taking a data science course. While our initial interest was aroused as part of the data science course, our concern grew in the topic as well as our self-interest in understanding how colleges and universities might impact the spread of COVID-19 in their respective communities. Initial data discovery and literature review indicated that the positivity rates for COVID-19 were highest in the 18 to 24-year-old age group in the U.S. And when looking at Ohio specifically, the Ohio Department of Health showed the highest positivity rates in the 0 to 19 and 20 to 29 age brackets. The age ranges suggested by both the U.S. and Ohio data are inclusive of the bulk of the populations most likely to be found at residential colleges. Most colleges sent students home in March of 2020 to finish out the remainder of the spring semester at home while they frantically prepared for the coming fall. Colleges, armed with constantly changing advice from the Centers for Disease Control, or the CDC, did their best to come up with plans to allow students to continue their education at their institution. Since there are many varieties of colleges and institutions in existence, we decided to focus on colleges or universities that were part of the National Collegiate Athletic Association, or the NCAA. Our reasoning was that institutions that were part of the NCAA were more likely to be institutions that had a largely residential population. So we chose to focus our study comparing counties with and those without NCAA colleges or universities. The fall of 2020 brought varied opening plans, ranging from in-person, reduced capacity courses, hybrid courses, remote courses, online courses, to various combinations of any of those listed. Mask mandates, COVID-19 testing, both random and on-demand, HVAC reviews and upgrades, increased sanitation protocols were all part of the strategies that colleges put into place to stop the spread of COVID-19 on campuses. With the pandemic still raging, as plans were being made for the fall of 2020, colleges were still called upon to keep students and their communities safe. This leads to our research question, and why do we think this is important? Many institutions developed comprehensive plans to keep students, staff, and faculty safe. Were these plans effective? Assessing the effectiveness of these plans will help in planning for the next pandemic because, just like computer failure, the question isn't if, but when.
In order to perform the analysis, several data sources needed to be considered. The COVID-19 case count data was obtained from New York Times repository. College data was gathered from the Integrated Post-Secondary Education Data System, or IPEDS, which was used to determine whether the county contained an NCAA competing college or not. The National Center for Health Statistics, or NCHS data, was used to determine whether a county is classified as metro or non-metro. Lastly, the US Census Bureau data was also added to get the 2020 county population. Prior to the analysis, there was some data cleaning and pre-processing involved. The data was filtered for only the state of Ohio, and since the subject of interest in this study is monthly increase in case counts, a data frame was constructed, transforming the daily case counts into cumulative case counts by date and county. As part of further data cleaning, many features like gender, date of death, hospitalized count, etc., those were dropped. And then the IPEDS data was merged into the cumulative case counts data frame to compare counties with and without NCAA colleges. The last classification that was added to the data frame is whether the county is classified as a metro or non-metro county, and that data was obtained from the NCHS. For further data processing, a monthly percentage change in case counts was calculated. An additional column was added to scale the data for the average cases per 100,000. And lastly, the average and median percentage were also calculated using four classifications: metro county with and without NC college, and non-metro county with and without NCAA college. After getting the final data frame, some exploratory data analysis was performed, which showed that the counties with colleges have lower monthly median percentage change in case counts as compared to the counties without colleges, as we can see from this graph. And when metro and non-metro subgroups were added, the graphs as shown here gave us the impression that the four data groups are fairly similar with respect to the average cases per 100,000.
To test whether or not our results were statistically significant, we applied the appropriate tests based on the normality of the data. Shapiro-Wilk, JB, and Komogrove were used to test for normality, and the results showed that our data was not normally distributed. Based on this, non-parametric tests, the Wilcoxon and Kruskal-Wallis test, were applied in order to determine statistical significance. The results of those tests show that college reopening does not impact the spread of COVID-19 cases in Ohio.
So the limitations of this paper is that this experiment was done only for the state of Ohio, even though it's a pandemic that affected the whole world. And also only institutions that compete in the NCAA sports were considered. And among those institutions, there's a lot of differences in terms of size, and they range from small private colleges to large public universities and in between them. And also the pandemic is currently ongoing. The data that was used in this paper stops at February 1st, 2022, which means that technically it is incomplete because cases are reported almost on a daily basis up to the time of the recording of this presentation. And in addition to that, the recording structure that was used in this paper. So, for example, the county that the student case was reported was taken into consideration, and but the number of student cases at each institution was not included. And lastly, the plans for students returning to campuses and the mode of instructions have a lot of variation from the hybrid model to the in-person model and also to the online model. And due to this variation, that also was not considered in this study. So to conclude this paper, I'll be talking about the findings that were made in this experiment. And the data that was used for the experiment that was conducted in this paper is from the start of the pandemic up until the February 1st of 2022. And the findings of this paper is initial, and it was from after the experiment. It was concluded that in the state of Ohio, the median percent change and the average cases per 100,000 in COVID-19 cases from the start of the pandemic through February 1st, 2022 is greater in counties that have colleges than counties that do not have colleges. However, the average percentage in college counties is less in counties that do not have colleges. And when further subdividing these cases per 100,000 by month, and whether there's an NCAA college present in both metro and non-metro counties, a statistical comparison among the mean of the four groups resulted in the acceptance of the hypothesis that the means were the same. And after the experiment that was conducted in the paper, a reflection on the mitigation strategies by colleges and universities used during the global pandemic is crucial for planning for future pandemics. And that brings us to the end of this paper. Thank you.